Now we are going to study the blood supply of the nasal septum. The nasal septum is supplied by both the internal carotid artery and the external carotid artery. Now the internal carotid artery gives the branch which is ophthalmic artery. The ophthalmic artery is the intracranial branch. Now it will give two branches which will be supplying the nasal septum. The first one is the anterior ethmoidal and the second one is the posterior ethmoidal artery. So these are the two branches of the ophthalmic artery, which is a branch of internal carotid artery, and ophthalmic artery is an intracranial branch which gives two branches, anterior and posterior ethmoidal artery, which are going to supply the nasal septum. Now talking about the external carotid artery, the external carotid artery gives two branches. The first one is the maxillary artery and the second one is facial artery. Now we are studying both maxillary artery and facial artery, as these are having a role in the supply of the nasal septum. The facial artery is the big artery. It gives the one artery which supplies the nasal septum, that is the superior labial artery. Now the superior labial artery is the supply of the upper lip, but it also gives the septal branch. So the septal branches of the superior labial artery. Now talking about the maxillary artery, it gives the two branches. The first is the sphenopalatine and the second one is the greater palatine artery. So both the sphenopalatine and the greater palatine artery will give the septal branches to the nasal septum. Now we should remember that the sphenopalatine artery is the most significant one here. I want to say that the sphenopalatine artery have the greatest role in the blood supply of the nasal septum. So briefly discussing again, the blood supply of the nasal septum is by both the internal and external carotid artery branches. The internal carotid artery gives the branch which is intracranial, that is ophthalmic artery, which further gives the two branches, anterior and posterior ethmoidal arteries, which are going to supply the nasal septum. Now the branches of external carotid artery are the maxillary and facial artery, which are involved in the supply of the nasal septum. Maxillary artery will give two branches. First is the sphenopalatine and second one is the greater palatine artery. These both arteries will give the septal branches to the nasal septum. The another one which we have to discuss here is the facial artery. Facial artery gives one branch. Another branches are not involved. The one branch involved here is the superior labial artery, who supplies the upper lip mainly, but it also gives the septal branches. So that's all about this blood supply of the nasal septum.